Thank you very much for DocTube for giving me this platform to initiate our public awareness program under non-communicable diseases, for which high blood pressure is very, very important. So this awareness program is under the aegis of Association of Physicians of India Malwa branch, RSSDI, Diabetes India Interest Group, and NAPI. So this gains importance because recently ICMR study suggested that more than 40% people in India are suffering from high blood pressure. So that is why we thought that a public awareness program where public should know, the common people should know what is high blood pressure and what information is important for them to tackle the problem of high blood pressure, how to prevent it also. So today's topic, high blood pressure, what people need to know, gains importance because the silent killer is increasingly being prevalent in India. So first of all, we must know what is high blood pressure. So hypertension might be defined as the level of blood pressure at which therapy reduces blood pressure related morbidity and mortality. So what does that mean? That means over a period of time, when we were students, 160 blood pressure was considered to be normal. So as the time progressed, more and more research evidences came, and that is going to define the blood pressure, that at blood pressure number where there is increased morbidity and mortality, we define it as hypertension. And for Indian guidelines, we follow the Indian guidelines. The optimal blood pressure is less than 120 millimeter of mercury systolic blood pressure, what is known as the upper blood pressure, and less than 80 millimeter of mercury is the lower blood pressure or diastolic blood pressure. We consider two blood pressure, one is systolic blood pressure, other is diastolic blood pressure. So optimum, that all the population are at benefit if the blood pressure is less than 120/80. And normal is considered according to Indian guidelines is blood pressure less than 130/85. And high normal is between 130 to 139 and diastolic 85 to 89. So that means that all the population below the blood pressure of 139 or equal to 139 are considered to be in normal range. So what is high blood pressure or hypertension? If the blood pressure is more than 140 systolic and more than 90 diastolic, we call the person as hypertensive. So there are three stages of hypertension, stage 1, stage 2, stage 3, depending upon the blood pressure. That if it is more than 60, we call it as stage 2. If it is more than 180, we call it as stage 3. So blood pressure can be isolated systolic or isolated diastolic. That means only systolic blood pressure is more, diastolic blood pressure is less, or only diastolic blood pressure is more and systolic blood pressure is normal. So that is how we define blood pressure. So all the people should keep in mind that if blood pressure is less than 140/90, they need lifestyle modification so that the blood pressure doesn't cross 140/90, so that they will become hypertensive. So nowadays, what is happening is we are promoting more and more home blood pressure monitoring as well as ambulatory blood pressure monitoring. Home monitoring means previously when you went to the doctor, doctor used to check the blood pressure in hospital. We call it as office blood pressure monitor, office blood pressure reading. And now with promotion of home blood pressure, we are educating patients as well as normal population so that they can check the blood pressure at home. And more people are now requiring, when they are suffering from blood pressure, the ambulatory blood pressure. Ambulatory means for 24 hours, we check the blood pressure. So with that, the values of blood pressure monitoring or blood hypertension definition changes. So office blood pressure, we have already discussed. If the person is having more than 140/90, we call it as hypertension. And if at home, the blood pressure is more than 135 and diastolic is more than 85, we call it as hypertension. So there is 5 millimeter of mercury decrease from office to home blood pressure monitoring. And for ambulatory blood pressure monitoring, there is more 5% decrease, that is more than 130, and more than 80, we call it as hypertension 24-hour monitoring. So we must remember that office blood pressure, home blood pressure, and ambulatory blood pressure, the definition of high blood pressure changes by about 5 millimeter of mercury. So then comes when we have hypertension and we are taking treatment, what should be the target blood pressure? How much blood pressure we should achieve so that we are protected? So if it is uncomplicated, without any problem, without any risk factors, we can achieve the blood pressure of about 40 to 40 systolic and 90 diastolic to be on safer side. But if we have some problem like heart disease, kidney disease, diabetes, then the target blood pressure, what we want to achieve is less than 130 systolic and less than 80 diastolic. So why we are talking this about high blood pressure? Because high blood pressure is a highly prevalent condition that results in significant mortality and morbidity. Worldwide, an estimated 1.2 billion adults aged between 30 to 79 have hypertension, and 46% adults are unaware of hypertension. So this is very important. Once a person is unaware of hypertension, then he is more prone for complications and mortality and morbidity. And 42% are diagnosed and treated, and 1 in 5 adults have it under control. So if we are treating 100 patients, only 20 patients are under control. So that is very, very important. That is why we are talking about high blood pressure, what people should know. When the people know that what is the target blood pressure to be achieved, they will be more careful in achieving the blood pressure. And you must know that hypertension is a major cause of premature death worldwide. When people die prematurely, you will find somehow hypertension is the culprit. Hypertension is a major contributor for cardiovascular mortality, that is heart-related mortality. And India is experiencing an increase in cardiovascular diseases, mainly due to uncontrolled hypertension. And recently, Indian study, ICMR study is out. You must have read in the newspapers that national prevalence of hypertension is about 35%, out of which 40% is in urban areas and 33% is in rural areas. And what is the difference between hypertension in Indian population and in Western population? The onset is relatively early in life. So Indian patients are of younger age group. There is urban-rural divide in prevalence. So there is difference between urban areas and rural areas. Clustering of multiple CV risk factors. We will be discussing risk factors in future. And significant seasonal variations of blood pressure. So especially in North India, where we find heat wave like this time, heat wave is going on. And in winters, there is severe winter. So there is significant seasonal variation of blood pressure, which people should know, because if they know there is seasonal blood pressure, they can always ask or they can adjust the medicine accordingly, according to the target blood pressure to be achieved. The rate of awareness is very, very important. Only 42% in urban areas and 25% in rural areas are aware of hypertension, and treatment rates are very, very dismal. That is only 38% people are being treated, and control, as we have already discussed, only 20% people have control in hypertension, which is much less than the Western population. And since hypertension is a major modifiable risk factor for heart as well as kidney diseases, improvement in hypertension, that is treatment as well as prevention in hypertension, will be a major improvement to improve people's health. So if on population basis, we estimate that 2 mm of blood pressure decrease on population basis in India will save about 1.5 lakh people dying due to heart disease, or about similar number of people dying because of stroke. So those are the preventive part if we decrease by 2 mm of population. So coming on to the risk factors. Who are the people who are at risk for hypertension? We divide risk factors into non-modifiable risk factors and modifiable risk factors. Non-modifiable means which cannot be modified. Like age, we cannot modify. There is risk of high blood pressure with age, and common in men more than 65 years and women more than 64 years. So race, again, black population is at risk. Family history of hypertension is very important. If your parents are having hypertension, that puts you at risk for hypertension, and certain chronic conditions like kidney disease, diabetes, etc. The people can have high blood pressure, and pregnancy sometimes causes high blood pressure, and exposure to racism, that is stress related, can cause blood pressure. So these are the non-modifiable risk factors which we cannot modify, and modifiable risk factors which we can modify. So person can have lifestyle modification to modify the risk factors. That is why they are known as modifiable risk factors. And most important is unhealthy diet, excessive salt consumption, low potassium level diet, high diet in saturated fats and trans fats, and low intake of fruit and vegetables. These are the dietary factors which we consider as unhealthy diet, which can cause hypertension, increased blood pressure. Physical inactivity is very, very important. Consumption of tobacco, consumption of alcohol, obesity or overweight, excessive intake of caffeine, and certain drugs like painkillers, steroids, and sympathomimetics. These are the drugs which puts patient into risk for hypertension. So these are modifiable risk factors. Why? Because we can modify our diet, we can increase the physical activity, we can stop using tobacco and alcohol, and we can control our weight and obesity, we can decrease weight, or we can decrease the caffeine intake. So all can be modified for prevention as well as for treatment of hypertension. And some of the emerging risk factors which are being discussed as well as research is going on, that if resting heart rate is more, your pulse rate is more, that puts you at risk for hypertension. Dyslipidemia, that are more fats in the blood. The hyperuricemia, if uric acid is more, then the person is at risk for hypertension. Impaired glucose regulation, poor estimated glomerular filtration rate, that is pre-diabetes as well as pre-kidney disease, and environmental factors. I must say that environmental factors like air pollution, noise pollution, ambient temperature are coming up as emerging risk factors. And air pollution is very important, because previously we used to think that air pollution is going to affect the lungs. But new research evidence is coming where air pollution is affecting the heart and causing hypertension in population. So we must control the environmental factors and pollution. So how do we manage? Now we know the definition of hypertension and we know the risk factors. So management of risk factors is very important for public health program. That is why we are conducting this awareness program, that all the population or people who have risk factors, what we have discussed, that is modifiable risk factors, because non-modifiable risk factors we cannot control. So we can always control the modifiable risk factors, and that is where awareness comes. If we are aware of the risk factors, that will help us prevention, detection, treatment, as well as control of high blood pressure. And it is more likely to be successful for prevention of hypertension as such. So it can be on population-based strategy and it can be intensive targeted strategy. So what is the difference? If we go for population-based strategy, so that means the government has to act, the social organizations have to act to make people aware why this blood pressure is increasing. And we can have this like our now recent debate is on the front of label, the projection. That is like cigarette packets are having the dangerous sign. Similarly, all the foods, especially the processed foods, they are high in salt, they are high in sugar, they are high in saturated and trans fats, but the label is not there. So there is star rating, which is very, very misleading. So if we have dangerous sign on foods, then people are able to choose the food that this is dangerous, this is having this much of salt, I should avoid this. So that is on population-based strategy. The intensive targeted strategy is once a person thinks that I am overweight or I am obese, so that is the targeted strategy, individual strategy, so that can modify risk factor individually. So we must have population-based strategy as well as intensive targeted strategy to control hypertension, to prevent hypertension. So that is how this is going to happen. And most important is dietary sodium restriction. Upper limit of dietary sodium intake is about 2.5 milligrams per day, 2.500 milligrams per day. So that is 2.5 grams per day. The lower intake of dietary sodium reduces the risk of cardiovascular diseases, especially through hypertension. Sodium reduction was associated with small but significant reduction in systolic blood pressure, and epidemiological evidence suggests association between dietary salt intake and elevated blood pressure. And Indian cooking methods always involve increase in sodium preparations. So the ICMR task force has conducted studies in 13 states and documented that average salt intake is 13.8 grams per day. And what is the recommended limit? It is 2.5 grams per day. So you can very well know how much salt we are taking daily. But that is high. WHO and the Indian guidelines recommend that sodium chloride should be less than 5 grams per day. What we was talking about, 2.5 grams of sodium only. And if we consider salt as such, so it is less than 5 grams per day. But we must be careful in Indian setup, where there is a lot of sweating. In summers, people working in fields, and sometimes they have to consume more salt to compensate the salt loss. So we must take an expert advice before increasing the salt or decreasing the salt intake, so that the doctor will be guiding us whether this salt intake is beneficial or it is harmful to you. The other thing is potassium supplementation. When we ask for potassium supplementation, the rock salt is very good source for potassium, and we should increase potassium supplementation. The black salt is also rich in potassium. So we can take both salts together to increase potassium intake and decrease sodium intake. And dietary recommendations in journal, all patients should be encouraged to adopt a heart-healthy diet, which is preventive for hypertension as well as cardiac diseases. Strongly encouraged to reduce total fat and saturated fat intake. The total fat should be reduced to about 30% of the calories, saturated fats to less than 10% of the calories, and we can increase the polysaturated and monosaturated fat, and we must not take trans fats, absolutely cessation for trans fats. Increase physical activity, regular aerobic exercise promotes weight loss, increase functional status, and decrease risk of cardiovascular diseases and all-cause mortality, as well as hypertension. A program for 30 to 45 minutes brisk walk or swimming 3 to 4 times a week can lower the blood pressure, and a meta-analysis identified that 4 mm of reduction in systolic blood pressure in exercising people as compared to the non-exercising people. So exercise recommended is 30 minutes for about 4 to 5 days a week is recommended. So total is 150 minutes per week. And we must do exercise whenever we find time. We must exercise. Tobacco again is very, very important. Both smoking as well as chewing tobacco should not be taken because it is a cardiovascular risk as well as risk for hypertension. And more importantly, what it is being projected as risk for cancer. So that is also there, but it is also risking increase in blood pressure as well as increase in heart diseases. Moderation of alcohol consumption. Now a big Indian study is there that alcohol in any amount is harmful, but those people who are already taking should reduce their alcohol intake to about 30 ml ethanol, that is 1 ounce, and 100 ml of beer, that is recommended, and that is less for even females. So for that purpose, those people who are already taking alcohol should decrease alcohol consumption, and the concept that alcohol is beneficial for heart is not there. Alcohol in any amount is harmful for health. Weight reduction, as little as 4.5 kg is found to reduce blood pressure in overweight and obese people. So weight reduction can be because with diet and with exercise, you can take the consultation of a dietary consultant to reduce weight, which is going to help you in reducing incidence of hypertension, controlling hypertension, and prevention and control of heart diseases. Caffeine intake should be reduced. And yoga and meditation and stress management is coming up very fast. Yesterday, day before yesterday, it was yoga day. So these exercises, yoga, meditation, and stress management in present day conditions of increased urbanization, increased stress are very, very useful. So then comes the management. How do we manage? I will not touch upon the management, but once you know your blood pressure is high, that is more than 140 systolic and 90 diastolic, we must identify what are the risk factors in one person, and that is modifiable risk factors. And we should try to control the risk factors if we are not having any other disease. Otherwise, if we are having risk factors as well as any other disease like heart disease, the diabetes, overweight, cancer, heart disease, etc., then we should consult a doctor so that he can manage our condition of hypertension. And if one is aware of hypertension and can control risk factors, majority of the time, you will not need any medicine. Even if you will need medicine, it will be in very less amount. So my advice is, a common person on population basis or individual basis should know at least 3 things. What is the level of blood pressure, where we call it as hypertension, that is above 140/90, we call it as high blood pressure or hypertension, and we want to achieve the blood pressure lesser than this. If we can control the risk factors, then it is very good. Otherwise, we need to take pharmacological medicine. That is, we need to take tablets. And second is, if we are taking tablets, if it is uncomplicated, we need to control the blood pressure below 140/90. And if we are having some problems, we need to control that below 130/80. But at all the time, we should take care of risk factors. Whether we are taking medicine or we are not taking medicine, we must control risk factors, which is going to help in prevention of hypertension, in control of hypertension, and in control or prevention of complications for hypertension. So these are the lifestyle diseases. We must go in for lifestyle modification to prevent, to control, to manage and prevent complications of hypertension, that is high blood pressure. So with this, I end my talk of awareness of hypertension with 3 things. You must know what is hypertension, and if there is hypertension, what needs to be done, what are the risk factors, and motivated to control risk factors for prevention of hypertension. Thank you very much. तो ऑफिस में ब्लड प्रेशर बढ़ता है, जनरली हम सोचते हैं कि किसी से लड़ाई होगी या गुस्सा हो गया तो ब्लड प्रेशर बढ़ गया. So we need to check the blood pressure at that time. Generally the blood pressure doesn't shoot up. एकदम से नहीं बढ़ता है, जिसका नॉर्मल रहता है उसका एकदम से नहीं बढ़ता है. But in rare cases it can happen. कभी कभी हो सकता है कई लोगों में, पर उनको अपना एक्सपर्ट चेकअप करवाना चाहिए डॉक्टर के पास जाकर. आपने कुछ नहीं करना है, आपने डॉक्टर के पास जाकर के उनकी दवाई सेट करवानी है जिससे उनका ब्लड प्रेशर 140/90 से नीचे रहे. अगर उनको कोई और प्रॉब्लम है तो टारगेट ब्लड प्रेशर इज 130/80. पहले ऐसे होता था कि अगर उम्र ज्यादा है तो ब्लड प्रेशर ज्यादा भी चल जाता था, पर अभी टॉलरेबल अमाउंट में अगर उनको कोई प्रॉब्लम नहीं आ रही है तो हमारा टारगेट 140/90 से नीचे है. तो आप अपने दादाजी को किसी अच्छे डॉक्टर को दिखाइए, वो आए 15 दिन या 1 महीने बाद बुला करके, अगर उनका ब्लड प्रेशर कंट्रोल में नहीं होता तो वो थोड़ी थोड़ी दवाई बढ़ाएंगे जिससे उनका ब्लड प्रेशर 140/90 से नीचे आ जाए. सॉल्ट जो नॉर्मल सॉल्ट है जिसको हम आयोडाइज सॉल्ट बोलते हैं, उसका जो रिक्वायरमेंट है कंजम्पशन शुड बी लेस देन 5 ग्राम्स पर डे. तो आप इससे अंदाजा लगा सकते हो कि 1 महीने में पूरी फैमिली में कितना सॉल्ट इनटेक हो रहा है. तो दैट वी कैन डिवाइड एंड सी वेदर वी आर एक्सीडिंग दैट सॉल्ट इनटेक और हम उससे बढ़ तो नहीं रहे हैं. अगर बढ़ रहे हैं तो हमको वो नमक कम करना चाहिए. और जो ऊपर से नमक खाते हैं, जैसे हमने लस्सी में डाल दिया या शिकंजी में डाल दिया या हमने ऊपर सलाद पे डालना है, तो उसमें रॉक सॉल्ट या ब्लैक सॉल्ट आप यूज कर सकते हो जिसमें मिनरल्स और पोटेशियम की क्वांटिटी ज्यादा रहती है. सो दैट यू कैन हैव ऑल द 3 सॉल्ट्स टुगेदर, जिसमें आयोडीन का भी कमी नहीं होएगा. अगर हम सिर्फ रॉक सॉल्ट या ब्लैक सॉल्ट यूज करेंगे तो उसमें आयोडीन डेफिशिएंसी हो जाती है. तो वी कैन मैनेज द सॉल्ट इनटेक. जैसा हमारा टेस्ट है, जैसे हमारा रहन सहन है, उसके हिसाब से हम अंदाजा लगा सकते हैं. पर सोडियम क्लोराइड जो हम नॉर्मल नमक बोलते हैं आयोडाइज सॉल्ट, उसकी जो कंजम्पशन है वो 5 ग्राम से कम होनी चाहिए पर डे. मॉर्निंग सर्ज इन ब्लड प्रेशर, बिल्कुल सही बात है आपका. ब्लड प्रेशर कई बार मॉर्निंग में बढ़ जाता है, तो वो कई बार मॉर्निंग में बढ़ता है, कई बार कम होता है. जिनमें बढ़ता है उनको दोबारा से अपने रिस्क फैक्टर प्रोफाइल देखना चाहिए कि उनका रिस्क फैक्टर प्रोफाइल कैसा है. अगर उनका रिस्क फैक्टर प्रोफाइल ठीक है तो उनको एम्बुलेटरी ब्लड प्रेशर मेजरमेंट की जरूरत है. एम्बुलेटरी ब्लड प्रेशर मींस 24 घंटे के ब्लड प्रेशर की मेजरमेंट की जरूरत है, जिसमें पता लगेगा कि रात में उनका बढ़ता है, सवेरे बढ़ता है, तो उसके हिसाब से उसका ट्रीटमेंट. पर फर्स्ट एंड फॉरमोस्ट इज रिस्क फैक्टर मैनेजमेंट. इसमें डाइट, एक्सरसाइज, वेट, टबैको, अल्कोहल, सब चीज का आपने परहेज करना है. तो उसके बाद भी अगर मॉर्निंग में ब्लड प्रेशर आपका ज्यादा रहता है तो एम्बुलेटरी ब्लड प्रेशर चेक करवाइए, जिससे आपका ब्लड प्रेशर प्रोफाइल पता लगेगा, उसके हिसाब से आपका ट्रीटमेंट होना. नॉट एट ऑल, यू शुड नॉट. सी, जो हम ब्लड प्रेशर का मेडिसिन लेते हैं, व्हाट वी टेक इज देयर इन ब्लड फॉर सम टाइम्स. इफ वी आर इन डाउट और वी हैव मिस्ड द मेडिसिन, यू कैन टेक दैट मेडिसिन व्हेनेवर यू रिमेंबर इट. जब भी आपको याद आए उसी दिन आप ले सकते हो, बट यू कैन नॉट टेक 2 टैबलेट्स नेक्स्ट डे, तो उसका एडिटिव इफेक्ट हो जाएगा. रिस्क फैक्टर सारे आपने डिस्कस किए हैं, जिसमें नमक का पहला है, वेट रिडक्शन है, एक्सरसाइज है जिसमें 150 मिनट्स एक्सरसाइज एवरी वीक. तो उसमें टबैको सिसेशन है, अल्कोहल की मॉडरेशन है, स्ट्रेस मैनेजमेंट है विद योगा एंड मेडिटेशन. सो दीज आर द रिस्क फैक्टर मैनेजमेंट. So if we control all the risk factors, still our blood pressure is high, then we must take treatment. We have initiated under the aegis of API Malwa branch, the Diabetes India, RSSDI, as well as NAPI. We are conducting so many sessions to make people aware of non-communicable diseases. Most important are hypertension, diabetes, and obesity. So these are the three diseases. If we control all these three diseases, we can decrease mortality and morbidity in India. Thank you very much for giving me this platform for conducting this awareness session. Thank you very much.